I'm sorry, I'm having to think about this. Okay. In the past, I would not have had the contentment that I have now. From the outside, you wouldn't have noticed much difference, but on the inside, there was a lot of turmoil. But even I didn't notice that a lot of the time. It was pushed down. My name is Margaret. I'm from New Zealand. On the outside, things went very well, until one day I found myself becoming unwell, and I quite quickly became very unwell. I woke up with just a little bit of pain and stiffness, and then it progressed quickly so that I couldn't open my jaw, maybe just 1 centimetre, maybe that far. It was swollen and sore, so I couldn't chew food. My mother came and made smoothies for me and mashed food. My spine became inflamed, my chest, my pelvis, my left elbow, both hands, wrists, fingers and thumbs, my right knee and my right ankle were all swollen and painful.
I started my own practice 21 years ago. Being in university and in the hospital working as a resident, you had not much time to ask yourself, why does the patient get sick?
I simply had to see them. I had to see them quickly. I had to deal with superficial issues. Okay, here's your symptoms. This is what I think you have. Here's a treatment for you, or here's something to seek to diagnose it better so that we can be more specific in our treatment. And here you go.
My approach had been what I had been taught to do, which was to look at a constellation of symptoms, put a label to that, a diagnosis to that, and then use the pharmaceutical management that is recommended for that condition.
And for many, many symptoms, we have no medication to even reduce the symptom or push it back. And so what do? The patient wants help, and you as a physician are unable to help.
Many of the cases that you deal with are what we would call chronic non-communicable diseases, like cardiovascular disease, atherosclerosis, stroke, cancer, autoimmune disease, hypertension, hypercholesterolemia, and so on, all sorts of conditions that are chronic non-communicable diseases. And our treatment modalities for these conditions are far from ideal. Far from ideal.
I knew the physical side of what the body was doing, and I knew which pharmaceutical products were recommended for addressing that effect, but it was never dealing with the cause.
Yes, I can give a name to the symptom.
And I was diagnosed with psoriatic arthritis, and I was told that this was an incurable autoimmune disease, that I would have it for life, that there was no cure for it, that there was medication that could manage it. And so I started on some quite high-dose steroids, anti-inflammatories for trying to control the pain and to give me enough movement that I could slowly and painfully get to work.
I could make them more comfortable. I could change their numbers a little bit.
But I don't know where it comes from.
I'm just having to continually add more higher dose or more medication on top of things in order to try to keep this under control, and it wasn't keeping it under control. And so with that, I got very frustrated.
So the doctors started me on immunosuppressant drugs. And so they tried me on a couple of different ones and tried to wean me off the steroids as these other ones took over. But every time they tried to wean me off the steroids, I would get worse, and so the dose of the steroids would be put up again.
Since we have not learned that in university and the hospital, I was challenged to either give up my job, because it's very, very unfulfilling to say, I don't know.
And I was never seeing the result that I wanted. I wasn't seeing restoration of health. I was just seeing a management of their disease.
And say, okay, take this, come back 3 months later or 6 months later. This is when I was working in family practice as well. And, and then they come back and they still have the same condition. And now they need either a higher strength of that medication, or they need a second medication on top of that, or even a third medication on top of that. And then you're just, you're adding on top of and adding on top of. And I realized I wasn't fixing anything.
The medication wasn't working. It was enough just to make it to work, but I was exhausted. I lost maybe 10 kg, and so I became very, very thin. My colleagues were concerned for me, and my children thought I might die.
I was faced with the question, why do I have this noise in my ear? Why do I have this nose bleeding, or even my cancer on the tongue, or all those symptoms that patients have? And I could not answer those questions. You can say, oh, it may be the risk factor of smoke when you have cancer of the tongue, or you might have drank too much alcohol. In the end, there was no way for me to say, oh, this cancer came because of this cause.
I tried many, many things. Like I scoured the internet for information on how I could get well. I read many books, or some of them I read from cover to cover. Most of them I read parts of it, searching for an answer, because there are some amazing stories, and I thought, if one person can recover, then another person can. I just need to find the key. And so I refused to stop searching.
And I wrestled with the questions of, am I missing something? Is there something more to explain how we function that I didn't understand and I hadn't been taught in medical school?
It was very necessary for me to come to a very clear understanding of what will bring the patient to the best health point.
And every month I would go to the specialist, and the specialist would say, now, Margaret, what have you researched this month? And I would tell them. One of the doctors even said, have you ever thought of becoming a health researcher? And I said, no, I just want to get well. And every month it was the same thing. There was no improvement in the disease at all. More and more joints and tendons were becoming involved. They would say, this is incurable. You'll be on immunosuppressant drugs for life. Yeah, and I would cry, because it was a very dismal thought. My life looked very bleak. I had my 3 youngest children were still at home. The youngest was 8. I had an 11-year-old and a 14-year-old at home. And I didn't know how I was going to care for them. I was very weak. I couldn't turn the key in the door to my office. My eldest daughter is a doctor, and she got me a little device to put the end of the key on to give more leverage so that I could unlock the door. I couldn't take the stairs anymore. I was the person who always took the stairs. I never took the elevator. But now I was forced to take the lift. But I couldn't push open the door to the toilet on the floor that I worked in because it was too heavy for me. I was very, very weak. When your joints are swollen and when they are inflamed, you have no power in them at all. And so I would have to take the elevator 2 flights down where there was a toilet door that I could manage to open. I couldn't grasp anything. I had no grip strength, so I couldn't hold on to a cup like this. I would have to hold it like this between my wrists. I just didn't know how I was going to look after my family. I didn't know how I was going to live well. I was thinking, how do people live with a chronic disease, that I need to live well. I have children to care for. I didn't know how I was going to continue to work. My aunts came and they dug a garden for me and they grew lots of greens, and every morning I would make a green smoothie. It helped the pain in my back a little bit. It certainly didn't cure me, but it did help with the pain. It didn't taste very nice and I would feel sick for about 20 minutes after I drank it. But it was worth it to have a bit more movement. I drove a manual car and it was very difficult for me to change gears. And so my children all learnt to change the gears, and my 8-year-old became so good at it that I never had to tell him what gear to change into and when to change. We became the smooth unit, and that was kind of a little bright spot. I tried fasting and I lost more weight. I became so thin that I would put a pair of track pants under my skinny jeans because I was just so embarrassed at how thin I was. I had fine blonde hair growing on my cheeks, long hair, which your body does to compensate for the loss of fat. And my kids thought I might die because I was just so thin and so weak. I don't know how I managed to work, but I did. And I would pass the doctors in the corridor at the hospital that I worked in. I could see the sympathy in their eyes. They really wanted to help me. And they were doing all they could. And they wanted to trial me on some new drugs, some experimental ones. But I had to give the ones I was on a fair trial first.
I think one of the major challenges was trying to understand how we function from a totally different perspective, a new foundation to build upon.
Because I had so many ideas in my mind. There's more than 400 schools of psychology. So if you have so many, it seems that none of them works properly. So you need to be very clear, to be pinpointing to the person, this is what you need to understand and what you need to stick to in order that you live a healthy life, and that the relationships with your beloved ones or the people you live with will not be affecting you in a way that you finally make yourself sick.
For a while, it upset everything I thought I knew.
And so I needed to reevaluate this, and it was hard. It was hard to sit back and actually question much of my education and what I had been trained in.
It took me some time to get to a point in which I could say, this is it. This is the proper way, the healthy way. This is the healthy counsel.
And to then to then really be able to learn how to help people and to start helping them in reversing their conditions and not just treating them.
That's why I had to go and search for myself, from where does disease come from, and understand what is the real cause of disease.
And it was about this time that my brother rang me from Germany. He lives in Germany, and he told me about this health seminar that he'd been to with Dr. Horst Mueller. I didn't understand anything he said. None of it made sense. But I heard one thing he said, and that was that this man might be able to help you. Now, I'd been looking for help everywhere. The only answers I could get was there was no help, that this was incurable. And so, of course, I emailed him, and I gave him a brief little description of my problem. And I remember exactly what he emailed back. He said, "Margaret, there is a solution to your problem in removing the cause." I had no idea what the cause was. But that gave me hope. This was the first hope that I had.
Everything in nature is determined by its needs. And so I was searching to find out what are the human needs.
The definition of need is it's something that's needed to sustain life, and it's not something that you can produce in yourself. You have to get it outside of yourself.
They are universal. It doesn't matter if you are dealing with a patient that is white or with a patient that is a black person, or if he is from Asia or from South America. The needs of a human being are universal.
And you cannot deny these needs. You can't choose to not have a need.
Our needs are set. We cannot even choose how to satisfy them. By the example, I cannot breathe to my ear. Yes, I must breathe through the nose or through my mouth. I cannot supply my need for water, for food, in another way than through my mouth.
Nobody can ever come to the conclusion that they don't need oxygen and then stop breathing and continue to live. It's just impossible. You can come to that conclusion, but you will find out very soon that you're wrong, because you'll start suffocating and then you'll eventually pass out, and if you don't breathe, then you're going to die. And the same thing with food and water and, all the rest of our physical needs.
We can choose certain things. We can choose what food to eat, what drink to drink, but we cannot choose to have a need to eat or drink or get sunbathing.
Physically, humans need oxygen. They need water. They need nutrients. They need sunlight. They need warmth and movement and so on, right? These are various different needs that we have as individuals. Animals have all of these needs. Humans have these needs.
The most basic need that I came to understand in the human being are his spiritual needs.
Or we might call them emotional needs.
And I suggest that those needs are even more important than the physical ones.
And those needs include things like love and harmony, and security, truth, understanding, acceptance, belonging, compassion.
Have a need for freedom. No one enjoys or likes to be in a jail or even in a house with someone that will rule out and say, you have to do this or you have to do that. My mom was very old, but she wanted to do things her way.
He cannot renounce security. That's why we have patients, or humanity just goes in fear and fear and fear. People get more fearful than ever before, suffering from panic attacks because they need security.
We have a great need for affection. There are numerous experiments, if we can put them that way, that show that babies that their mother has passed away during delivery or something, they need affection to grow up and develop even physically properly, right?
But in my search and speaking with my patients, I realized it was not about food, it was not about sleep or anything that we would say that's the physical element. It was always in relationships.
I was quite a fearful child. My family was like many other families with a little bit of dysfunction. was nothing too dramatic. But my mother was very unhappy, and I felt very sorry for her. I saw her crying many times, and I imagine that it had quite an impact on me. When I first started school, I didn't speak for 6 weeks, and they thought maybe I couldn't speak. However, I adjusted to school, and I did speak, but I was very painfully shy. So shy that it was very difficult for me to speak with any volume in my voice, to speak without blushing. Sometimes I would sit by myself in the playground, and I was just too shy to run along and join in with the other children playing. I met my first husband as a teenager and had my first child when I was 16. We were not yet married, and we got married when I was 18. I'd finished my schooling after I'd had my first baby and started some university training, then had the second child, and so didn't go back because I wanted to stay home with my children, which I have never regretted. It was a really lovely time, but it was a lonely time because the marriage was an unhappy one, and I didn't feel fulfilled. So when that ended, I became a nurse and then a midwife, and 8 years later I married again, hoping that this time I would find the happiness that I was looking for. And that did not turn out so well. In fact, I looked back on the first marriage and thought it wasn't so bad. That's not to blame anyone, but we were ignorant of how we could truly love one another and get along well. There were many childhood difficulties and that my husband had experienced, and which of course had an impact on him. He loved me very much, but there was difficulty in how to show that and how to live together in harmony and happily. And so I became more and more unhappy. Shortly after our marriage, he sustained a mild traumatic head injury, and all the difficulties he had were exacerbated. And at that point, I really wasn't able to cope. Well, I coped for some years, but eventually with the stresses of the impact of his injury on the family, because of the head injury, he became quite unreasonable through no fault of his own. And so I felt like I was treading water to try and keep things together until one day everything fell apart and I became very unwell. I became physically sick as well as mentally unwell as it was unravelling, and seemed to then on my own get back on my feet with a lot of help from my family. I had a great job as a clinical midwife specialist. I had, it was a promotion, it was more money. We built a house in the country, which had always been a dream of mine, and but I was still seeking for something that would satisfy.
Humans search for something that we never learned that it's their need, and that it even has a physical application in it, was very new to me.
I felt very alone and just unsatisfied, I think, and that I guess I really felt ripped off. Like I really dearly wanted to have a family that was harmonious. I wanted a husband and a father for my children, but because of his head injury, I could no longer cope with his severe depression and his unreasonableness. and I had become mentally unwell myself. His behaviour was quite strange at times.
So in explaining the spiritual needs of a human being, I say love is the diamond. So if you are in certain situation, you will see this phase of love. So you will perceive love as a need for freedom. If you are living this other situation in your life, you will perceive your need for love as a need for loyalty, and so on. So all those things will make up a big element, which is that big diamond.
Just wanted him to love me the way I felt I needed to be loved. And so I felt alone, and I felt like I just didn't want to live anymore. I couldn't see things getting better when he had a diagnosis that was quite severe. I didn't want to leave him, but I was starting to unravel myself. The doctor said, I usually would say to try and try and try again in a marriage, but he said, you need to leave. That's all he said to me.
Among the challenges that you face as a psychiatrist is that people will naturally ask you for counsels. You know that you don't have to tell people this is what you have to do or this you don't have to do. You don't have to give a prescription on the behavior of people. Everyone must decide what to do or what not to. However, you have to be clear on what are the principles that should be underlining the questions that you're going to make to the patient so that he can find his own way out.
And I didn't want to leave, and at that point I didn't. It was about a year later when I talked to a psychiatrist, and because I was still struggling myself, and she said, how long has it been like this? And do you really think it's going to change? And she said to me, how long will you give it? And so I don't know, I said 1 month. And 3 weeks later, when things were not going well, and the relationship was deteriorating, maybe becoming a little bit physical, I decided at that point to leave. And then I started this new life, which was painful at first, very difficult because I was still very, very depressed. I never thought that I would be able to work again, but I managed to get a job because I needed the money. So I went back to work at the local hospital. And so I did that because in the second marriage I had 3 more children. And at that point in time, I couldn't see what a wonderful thing that was to have 3 lovely children, but everything seemed bleak. It seemed bleak for me and bleak for them. And so I started to build my life on my own, and it looked good on the outside. It looked really good. This brand new house in the country, a new job, a promotion, doing really well. But on the inside, very unsatisfied.
Whether you recognize that you have the need or not, the need exists. And as long as the need is supplied, well, you might not recognize that you have the need. But once the need is missing, then you recognize, oh, something's wrong. And there are always symptoms, uncomfortable symptoms that we experience when our needs are not fulfilled. If you need water but you're not getting it, well, you feel thirst. If you need oxygen but you're not getting it, you feel suffocation, and so on. And if you need respect but you're not getting it, you feel disrespect. And if you need understanding but you're not getting it, you feel misunderstood. If you need acceptance but you're not getting it, you feel rejection. If you need belonging but you're not getting it, you feel abandonment, and so on.
And when there is lack of loyalty, when there is betraying the one member in the couple, it can be either the man or the woman, the health of the person that is experiencing the betrayal start to come down. They will start with sleepless nights, with stomach aches, with a rash in their skin, and several diseases that will add one to another unless the situation is solved somehow.
These negative symptoms are a sign that something that you need is not being fulfilled, because if you go for too long without it, you're going to die.
There are fundamental laws that govern nature and govern our body.
And those laws never change, just like the laws of nature. Gravity never changes, thermodynamics don't change, laws of motion don't change, and so on. We seek to understand them and to be able to describe them, but they are what they are and they don't change.
We can only satisfy them in the way they were made to be satisfied, from the sources from where you can only satisfy them. If I need oxygen, I cannot jump into the water and take a deep breath, because water is not the source where I have to supply my need for oxygen. It might be for the fish, but not for me.
And the laws that govern our needs don't just govern our physical needs, but they also govern our spiritual needs. And so both are governed by law and both are unchangeable.
If the mind doesn't have what it needs, how does it reveal that? How does it present it? It presents it through dysfunction in the body.
And when you start gathering that history and you start comparing it with their health history, you begin to find a very significant pattern where there's some kind of major issue going on in the life of the individual, spiritually or relationship-wise, and you begin to see a very tight correlation between what's going on in the mind of the individual and then what develops in their body.
When I was sick, I was full of fear. I thought I might die. I thought my lifespan would be greatly shortened. Now, I am named after my great aunt, Margaret, who lived to be 1 month off 104. Because she lived to a great age, I always imagined I would live to 100. But now I was 48 years old, and I thought that I would not live that long. I didn't know how long, but I just thought my lifespan was going to be shortened. And I was most concerned about my children. I didn't know how I was going to take care of them. I didn't know how I was going to continue to work. Before my brother phoned me from Germany, I was to the point of giving up my job because I was so weak and so debilitated. I was just exhausted. Yeah, he made a time to ring me. He just wanted to give me this information that he had found that would help people understand the cause of their disease and then remove it.
2.5 years of exploring patient after patient, I had to bow down my mind in front of the things that I saw, that love or spiritual elements like justice, security are basic needs for the human life.
You know, hope is a wonderful thing. When you have no hope, when all you have is despair, when your life looks bleak, when your health is getting worse, and you read some statistics that say that people with severe multi-joint arthritis, that about 50% of them are dead in 5 years. That's quite scary. So we had follow-up emails and follow-up phone conversations, and I did wrestle with it for a while because of my background in health as a nurse and a midwife. Was different to what this doctor was saying. But at the same time, it sounded so reasonable. And there came a point where he said to me, Margaret, have you found what you're looking for? Have you found the solution, or are you still looking? And I thought to myself, well, I will give this a go. And so I determined that I would put into practice what I understood of what he was telling me. to my best ability. And I cancelled my appointment with the specialist for the next month. I had my bloods taken as I normally would. But I couldn't face the negativity of being told that this will never work, because I did tell them about what this doctor had said. And I remember the doctor said, "You just keep believing that, Margaret," as if I was mad, and just ushered me out of his office. And so I cancelled the appointment. I saw that we're all the same inside. We look different on the outside. Our behaviours can be different. But on the inside, we're all the same. We all need love, we all want love, and we all do what we can to get it. And that can drive us to desperate things sometimes.
It's evidently that humans starve or go after love first, because they cannot renounce that. That's why a person in a certain circumstance where he has to renounce love or life, he will renounce on life, but he can never renounce on love.
Love is the great need of the human spirit. We cannot live without it. We walk around in life as human beings with a big radar, so to say, that we are trying to find love. Yeah? And whenever we sense love, we immediately direct our attention to that situation, to that person. And whenever we don't find it, we immediately feel it or sense it as something negative, and we want to avoid that situation.
So the deception that love comes from within myself leads me to the idea that if I produce love, you have to produce it as well, and you have to give it to me as well as I give it to you. But it doesn't make sense. If I produce it, why should I need it? Why should I need your production? If in the capacity to love, love would be included, then why would I search for it? Why would I ask for it? If I have a well for water in myself, how would I go to drink water from the well? It is nonsense. So on the one side, the human says, "Oh, my love comes from my heart." But on the other one, he says, "Oh, I gave, and I'm empty." You either produce it, and you have it in, yes, all the time because you produce it yourself, or you need to supply it from outside.
And so where does love come from? If it's something that I need and I don't produce it, then who does? Where do I get it? Can my spouse produce it? She needs it too. She can't produce it either.
So in humanity, we do have a problem. And that problem is that we take for ourselves a source that needs the same things that we need. And that becomes very problematic, because if a source needs the same things that you need, then it can't be the source. For example, you take a tree and you uproot its roots and you put its roots in a second tree. And you take that second tree and you uproot it and you put its roots in a third tree. And you take that third tree and you uproot it and put its roots in a fourth tree. And you keep doing that with all the trees until all of the trees have their roots in other trees. What are going to happen to all the trees? They're all going to die. Because no tree can be a source for another tree, because all trees have the same needs. And the same principle applies when it comes to humans, and that is that humans all have the same needs. And we automatically take other people as our source. It's not something that we have to think about, we just do it.
In the moment when we're put under pressure, it's very easy to disconnect from the source of love, because we're all born through no fault of our own, but it's a sinful world, and all we've inherited is a wrong evaluation system. We look at things the wrong way. We so easily judge. I so easily judge. I so quickly am full of pride. So it's easy. But there's a ready solution, and it's always there for me to take.
you're born and you take mommy as your source, and you take daddy as your source, and you take your siblings as your source. And what are some signs that show that I have other people as my source or another person as my source? Well, I get frustrated with them. I get upset at them. I feel controlled by them. And if I find myself needing them to be a certain way in order for me to be a certain way, then I can be sure that I have them as my source.
People can't help having a faulty evaluation system that they've inherited. And so instead of trying to force people to see my way, I can understand what they do. They do it without a choice.
Because in taking other people as our source, they don't have what we need. It's like us taking our roots and putting them into, if we were a tree, into another tree, and now expecting that other tree to support us, or multiple other trees. But if we find that all people have their roots in other people, then it's all going to fall apart because everybody has the same needs and nobody can supply what everybody needs. All right, so who should be my source? My source needs to be something that has what I need. It needs to be something that doesn't need what I need. So I don't need a little love, I need all love. I don't need a little compassion, I need all compassion. I don't need a little respect, I need all respect, and so on. And I don't need it just some of the time, I need it all of the time. So I need it full, I need it constant, I need it personal, I don't just need an impersonal thing, and I need it unselfish. And so everything that I need, all of these, we might call them the emotional needs. Where have you ever found that in another person?
The thing that really helped me, that I learned from the doctor, was that a person can never be my love source, because I need love, other people need love, and by definition, if we need something, we cannot produce it ourselves. So why would I imagine that someone else can give me something that they also need? It's like the air that we all need to breathe. I would never expect someone else to give me their oxygen. They have to take it from the air just like I do. My message to those who are sick is that there is hope. There is great hope that you can get well. There is exactly what the doctor said to me. There is a solution to your health problem in removing the cause.